Welcome once more to Ask Your Midwife. Today I've compiled information on hiccup because as I was carrying about my duty on the ward, there was this baby that after the mother finished breastfeeding, the baby started having hiccups. And this is a woman who is a first-time mother. So you could sense anxiety. She was like, why is my baby hiccuping? Is my baby okay? Then we tried to tell her that baby is fine. But what she needs to do is she should burp the baby. When she burps the baby, it will go. And anytime it happens that way, she should try to feed or breastfeed the baby. So right now, when we say hiccup, it's caused by involuntary contraction of the diaphragm. And this involuntary contraction of the diaphragm causes the vocal cords to close briefly. And when it does that, it produces that characteristic sound or the hiccuping sound that the baby presents with. Now, what causes hiccups in babies? Mostly it is caused by overfeeding. Overfeeding, yes. When the baby is overfed, it causes the distended abdomen to mount pressure on the diaphragm, which will cause the diaphragm to go into spasms. And when it goes into spasm, then it causes the vocal cords to what? To close up a bit. Then the hiccuping sound will what? Come out. Then it's also caused by air. Air in the sense that mothers, mostly, especially newborn mothers, even some mothers, but mostly we say newborn mothers because they are first-time mothers trying to learn how to position and attach baby to the breast. But ideally, when you are breastfeeding the baby is supposed to take much of the areola, that is the darkened part of the breast. When it happens that way, when you really do good positioning and attachment, baby wouldn't make any sound whilst breastfeeding. But when you are breastfeeding and baby starts making sounds, that means the baby is not taking the breast milk, but rather taking air. This air will cause the stomach to become distended because more air will enter into the abdomen. And when the stomach becomes distended, it's also push pressure on this diaphragm for the baby to start, and this diaphragm will go into spasm, and it will cause the baby to go start having that hiccuping sound. Okay, then we can also talk about overfeeding. As you are breastfeeding, ensure that you are not overfeeding your baby. When you feed the first breast milk for the first 30 minutes, you have to burp the child. Burping the child is gently rubbing the baby's back for the baby to break wind or to belch. Yes. When you do that, it will not let the baby have that hiccuping sound. But when you overfeed the baby, still the stomach will put pressure on the diaphragm, which will cause the diaphragm to go into spasm. So here the main cause is the extension or the distension of the stomach, putting pressure on the diaphragm, for the diaphragm to go into spasms, but for it to also go through the vocal cords, for the baby to what? Have that hiccuping sounds. Though though most of the times we relate or we link hiccups to feeding issues, that is overfeeding, not properly positioning and attaching the baby to the breast, where the baby takes in too much air. We have other causes like gastroesophageal reflux disease, popularly known as GERD. With this one too, you realize that baby's food is partially digested. It happens when the baby's food is partially digested in the stomach, and then the acidic juices from the stomach will also flow back, so there is reflux. Okay, and when there is reflux, it causes burning sensations and discomfort. And since the esophagus also passes through the diaphragm, it can irritate it. It will irritate the diaphragm for the baby to have those kind of sounds or hiccuping sounds. But with this, when it's also with the GERD, it's also related to other signs and symptoms. Okay, like your baby crying more frequently, and then baby's back acts. There's action of the back. Okay, during or after regular feeding, baby starts fitting more. And when you see these things, and not that you are not too comfortable, as you are breastfeeding, baby must be relaxed. Okay, but when you are feeding, baby is having these kind of symptoms, please just try to see a pediatrician so that they'll be able to help the baby. Then one will ask, is it normal for a baby to hiccup? Is it normal? Yes, it is normal for a baby to hiccup, and it is harmless. Baby, it's okay, but for mothers or first-time mothers and fathers, they'll see it like baby is not okay, or baby is in a form of distress. Okay, but it is normal for a baby to hiccup, and as the baby starts growing, you realize that the diaphragm, which is immature, which goes into spasm as baby starts growing, it also starts, the internal organs also start developing, which will also cause the hiccups to gradually subside. So it is normal for a baby to hiccup. Okay, then how many times will is it normal, or how many times in a day do we say it's normal for a baby to hiccup? We are saying that babies can have multiple hiccups a day, but the duration should be 10 minutes or longer. But if you feel that, or if you the mother, you feel that baby is uncomfortable, or you are not comfortable with it, please try to see a pediatrician as soon as possible. Okay, then how do we get rid of hiccups? How do we get rid of hiccups? We already have mentioned that hiccups is due to feeding related issues, overfeeding, baby taking in air during breast milk. Okay, so with this, you have to feed baby in bits. You feed baby in bits, and you also make sure that you burp the baby, or you break wind for the baby to burp, so that there wouldn't be gas or air in the stomach. When you do this, you'll be able to get rid of hiccups in a baby. And also make sure that when you are breastfeeding your baby is well positioned and attached to the breast, so that baby won't be taking in air. Baby should rather be taking in the breast milk, not the air. So make sure that when you are breastfeeding, baby doesn't make sounds. Baby is not supposed to make sounds whilst breastfeeding. Now, in our setup, you realize that in our African setup, or in Ghana to be precise, realize that when a baby hiccups, you realize the mother will put a white thread at the anterior fontanelle. It's an old practice that we do. Mothers, it won't let the hiccuping go. Yours is to what? Burp your baby, proper position your baby and attach to their breasts. Others also have this myth saying that it will let the babies, it helps the baby's ribs to enlarge, the stomach to enlarge, making it's also a possibility that the baby will grow fat. Please, I'm begging you, it's not a possibility that it will make the baby grow fat, or the ribs will enlarge, or the baby will grow fat. Hiccups is simply a distension of the stomach, which puts pressure on the diaphragm for the diaphragm to go into spasms, thereby causing the vocal cords to produce such sounds. That's hiccuping sounds. So in conclusion, my dear mothers, my dear fathers, my dear grandmothers, and to everyone, hiccup is not something which is dangerous or alarming. But in a situation whereby you, the mother, you are not comfortable, kindly see a pediatrician. Okay, thank you very much.